Hello, this is Dr. Atta from DestroySocialAnxiety.com, and today I wanted to talk about a role of exercise in our mental health. Generally speaking, exercise is an extremely important activity. The reason for that is that if somebody is anxious, if we have anxiety, that's typically our biological reaction to threat. And when we are afraid of something, in this particular case, afraid of social interactions, our body requires a physiological response to that. And what does that mean? That means that if our body thinks we are under threat, our body demands one of two options. One is to fight, and the other one is to run away. So that's what it's called, fight or flight response. And that has to do with our original programming, in which in response to threat we were supposed to do one of those two things, because there is essentially no third option. Some people say there is a third option of freezing, meaning not doing anything, but that's in my view just kind of preparation for demise, and I'm not sure if it works that effectively in humans, and also I do not see much benefit to utilizing that particular mechanism in helping ourselves. So our body wants to have this fighting or running away response, and that's where the exercise comes in. We are providing this response by exercising. And what is the typical parameters of exercising that we are looking for to decrease our anxiety and general anxiety, and in a sense also to some degree a level of social anxiety? We want it to be fairly lengthy and typically a cardiovascular exercise. So any kind of exercise that is weight-based is not necessarily very useful. It has its advantages, of course, but mostly for other reasons. For reasons of social anxiety and anxiety in general, we want cardio exercises. By cardio exercises, I mean exercises that put your heart rate on a level of about, I believe it's 65 to 70% of your maximum heart rate. You calculate it by taking the maximum heart rate first, and that I believe is 225 heart beats per minute minus the age of the person. So for example, if you are 45 years old, and so your maximum heart rate should be for the purposes 180, and then you take, let's say, 65 to 70% of that, and that would be your cardio rate for that purpose. And that it has to be fairly lengthy exercise. Our goal is on average to do it 30 minutes at each session, which obviously corresponds to the original programming again, because if you are engaging in escaping or fighting, that's usually a lengthy process. Doesn't happen immediately, and the frequency is at least should be 3 times a week, and that's shown to have some benefits in decreasing the anxiety. That would be very helpful if one could implement it in a weekly regular routine. People who exercise on a regular basis are typically less anxious than people who don't, especially if you engage in aerobic cardiovascular exercises. So that brings me to the concept of what makes it so that certain people are more successful in their exercise routine and others are less. And from what I've been able to observe, since the New Year's is coming, we have a lot of New Year's resolutions, and it appears that people go to the gym on the 1st of January, they train for a month like crazy, and then they stop. The question is, what does it take to increase the chance of success that your exercise routine is going to be more regular, more scheduled? I see majority of people I see are usually not successful in exercise routine, but there is a small percentage of people that I've observed that are successful in the exercise routine, and the question was, what do they do differently? So I'm just going to give some of the pointers that I've observed. Okay, again, this is not written in stone. This is not I'm not sure if it's based in science, but that's my observation. That's been, I'm pretty confident that it works. So the first part about the exercise, it has to be something that you kind of relate to. So it's something that you like. For example, if it's exercise that you really, really hate and you really dislike, it's the chance of sticking to it long term is not very high. So it has to be something you kind of enjoy. That's number one. Number two, it helps if the exercise regimen is scheduled. It's much better for the exercise regimen to be scheduled than unscheduled. By schedule, I mean it starts at a specific hour. It's not like I'm going to go to the gym anytime I want. I'm going to go to the gym for the class that starts at 8 or 9 o'clock. That's what makes a difference. So the scheduled regimen is better than unscheduled. Another element is structure. So it is better if I go to the gym and there is somebody or some kind of a mechanism that tells you exactly what you are supposed to do on during the given session. And obviously, a lot of people would say, yes, the personal trainer would be the best, but it's very, very expensive. And I totally understand, but there are alternative options to having a personal trainer. Those are computer apps, for example, or manualized exercise books, as well as exercises that are kind of in between structured and unstructured, such as CrossFit sessions, in which you come at a certain hours and there's a trainer who directs a whole group of people who exercise, or martial arts classes where you have a similar situation. There is this person who tells you what to do during the session. The next thing is, it always helps if there is some element of competition, or even if not competition, goal setting. So when I go to the gym, I not only go and just work out, but I have a certain goal in my mind, be it compete with another person, be it preparing for a competition, preparing for a tournament. Anything that focuses you on a goal in the future is very, very helpful in that. And lastly, I believe it is very helpful that the exercise regimen involves some kind of a social interaction and social support system. And by this, I mean you are in an environment that you interact with other people, you talk to other people, you support each other, and you have common interests. That's been very helpful. So in my view, the ideal exercise regimen combines all of those elements. There are plenty of options available, but if you decide to implement exercise in your daily life, and I think everybody should, those would be the elements to follow. Thank you very much.